Simon, I think, did I read this before? He says too much emphasis spent on pointing out the reasons why we shouldn't manipulate. Oh yeah, he says he used to teach and found the students became terrified to manipulate at all and thinks we've gone too far in the wrong direction. Yeah. Yeah, absolutely right. I mean, I'm sure that I've spoken to students from various courses or new graduates, and they've come out and they just think, yeah, we know how to do it, but we don't like it. We're not going to do it. How much do you think that affects their ability to resolve problems in patients?
I think it does. This Saturday, I was doing some work in Hatfield with a clinic down there. There's a lady from Barnet who learned, she was qualified, she knew what she was doing. She won't use manipulation because it hurts. Come out the front. She came out the front. You've got this bang, that bang. Oh, that's all right. She then said, I can now do it. I know what I'm doing. Because I'm now looking at the final thing, not the wind-up. The final thing is getting that tension right. This takes time to feel it. And she completely changed her approach after that.
But presumably, if she stayed in business, she was getting results without doing manipulation before.
But working 10 times, 10 treatments to do what I'm doing in the first session.
Yeah. Interesting you say that, because of course one of the things I've heard you talk about is how you in a court of law afterwards justify the fact that you use this technique on a patient. Now, have you been in the situation of having to justify it, or as an expert witness for somebody else who's had it?
I've acted as an expert witness with a few people, and that's one query that the lawyers, who are very good at what they do, they ask them, why did you do a thrust? And you've got to have the reasons. A, it's quicker, it saves a lot of time. B, you're putting an impulse into the tissue, even very gentle one, which you get reaction to. C, the patient thinks it's better. Lots of different reasons why you do it.
Right, okay.
And if you don't do it, you don't get the same change. You can work on that tissue for ages. There's something about that makes a change.